Welcome to the course. In this presentation, we can see an awareness on women's health issues during COVID-19. Introduction. At present, the world is facing a global health crisis that affect people, especially for women, in different ways. COVID-19 has deepened pre-existing inequalities and exposed gaps in our systems, and also amplifying the effects of the pandemic. Physical distancing and stay-at-home orders had larger implications for women in every sphere of their lives. So nearly 70% of women work in the informal economy. They hold less secure jobs, earn less, and save less. We feel strongly about the need to understand and share some knowledge about the health issues, including mental health, psychological impact, and well being of COVID 19, and help people to cope with its challenges. So, we have to consider our economic, social, political, and human rights factors and the challenges women face in maintaining health and managing their lives in the face of societal pressures and obstacles. We can move on to the women's health issues. So COVID-19 pandemic, we are all experiencing massive changes in how we live and interact with one another. So vital international efforts to contain coronavirus have radically transformed our personal and professional lives. But many of us are caring for those who are vulnerable, and some of us will be vulnerable ourselves. So it's difficult to imagine a time where there was as much anxiety and uncertainty for individuals and societies about what the future may hold. While the virus itself is unlikely to directly affect us all, most will experience varying levels of psychological distress as a result. So, the challenge of the last month and weeks of COVID 19 have been enormous. The nightmares for any of the death and the illness within their families is only just being understood fully. With the sharp rise in unemployment and the limited access to social protections, women do not have the capacity to absorb the economic shocks and are at greater risk of falling into poverty. So, burdens in household responsibilities. So, women are spreading themselves thin as they bear the burden of household responsibilities. So, competing home and work demands place their jobs at further risk and layoffs. Next, single parent or female headed households are facing significant difficulty in supporting themselves and their families. So, loss of financial independence along with control of finance keeps women wound to relationships and also increases their vulnerability to experience exploitation and abuse. And also restriction of movement and limited decision making and lowered social bargaining power and threatened their safety and autonomy at home. And also neglectful strategies involve withholding interactions and invalidating their feelings and communicating into a woman that she is inferior. So WHO, World Health Organization guidance on health finance policy is ultimately focused on strengthening health system resilience and health security and universal health coverage. So now we can move on to the psychological impact. Psychological abuse is often a precursor to physical and sexual violence in relationship, so depriving them of basic needs, causing harm, and using coercion, manipulation, or guilt to have sex and making offensive statements about one's sexuality and body, and disconnection from social networks, an inability to seek temporary refuge from outside spaces or have access to private spaces. So, women are experiencing chronic distress. So, also, women trapped in an escalating cycle of tension, power, and control are vulnerable to experiencing various mental health concerns, including depression, anxiety, and trauma. Stigma and lack of social support often lead to internationalization of abuse and directing the anger, humiliation, and fear towards themselves, and aggravating feelings of worthlessness and helplessness. So, these may also result in trauma bonding. If a woman experiences abuse from a partner who also expresses love, they learn to associate love with abuse. So they often rationalize, justify, or minimize the abuse and are less likely to report it. So now I can share about the mental health conditions during COVID-19. As countries introduce measures to restrict movement as part of efforts to reduce the number of people infected with COVID-19, and more of us are talking huge changes to our daily routines. So during the pandemic, as healthcare resources are often diverted from routine health services, and women do not have access to sexual, reproductive, and maternal health services. So challenges in accessing contraception and safe abortion and medication, violence and feeling of shame and lowered self-worth and heightened their risks to women's health and well-being. So time and time again, women have proved to be the backbone of recovery in communities as they sustain their families, households, and communities during difficult times. So these are new realities of working from home, temporary unemployment, homeschooling of children, and lack of physical contact with other family members, friends, and colleagues take time to get used to. So, adapting to lifestyle changes, managing the fear of contracting the virus, and worry about people close to us who are particularly vulnerable. Or these are all challenging for all of us. They can be particularly difficult for people with mental health conditions. So, avoid these using an unhelpful coping strategies such as tobacco, alcohol, or other drugs. So these can worsen your mental and physical well-being. So visible and invisible wounds of exploitation and abuse remain with women throughout their lives. So these are all some signs of mental illness during COVID-19. So as follows. So negative self-perception, persistent low anxious or erratic mood, inability to experience pleasure, and difficulty with attention or memory, and lots of changes in appetite and sleep, fatigue, bodily pains, and thoughts of self-harm and suicide. So they seek support from a mental health professional if they are experiencing these concerns. So stress and the feelings associated with it by no means a reflection that you cannot do your job or that you are weak. So at last here are some guidelines to stay healthy at home. So physical activities in COVID-19 pandemic means that many of us are staying at home and doing less in terms of social interactions and exercise. So this can have a negative effect on your physical and mental health. So physical activity is benefits for both the body and mind. It can reduce high blood pressure, help manage weight, and reduce the risk of heart disease, stroke, type 2 diabetes, and various cancers, all conditions that can increase susceptibility to COVID-19. So regular physical activity can help give our days a routine and be a way to stay in contact with family and friends. So WHO recommends that all healthy adults do 10 minutes per day of physical activity and children should be physically active for 1 hour per day. So try exercise classes online or dance to music, play active video games, try skipping rope, do some muscle strength and balance training, And also regularly check your sitting posture while working from home. And another important thing is break up your sitting and stand up while working or on the phone or watching TV. And another important thing is walk up and down these chairs, do some stretching exercises and dance to music for a few minutes or seeking more ideas and resources online. So another important thing is we have to keep them safe with our open communication. So there are the 5 ways you can help keep your children safe online. So have an honest dialogue with your children about who they communicate with and how. Make sure they understand the value of kind and supportive interaction and that mean discriminatory or inappropriate contact is never acceptable. Next thing, use technology to protect them. Check that your child's device is running the latest software and antivirus program and that privacy settings are on. Keep webcams covered when not in use. Next important thing is spend time with them online. So create opportunities for your child to have safe and positive online interactions with friends, family, and also you. Connecting with others is important, more important than ever at the moment, and this can be excellent opportunity for you to model kindness and empathy in your virtual interactions. Next important thing, let them have some fun and express themselves. So encourage healthy online habits. Next thing, promote and monitor good behavior online and on video calls. Encourage your children to be kind and respectful to classmates, to be mindful of what clothes they wear, and to avoid joining video calls from your bedroom. Another important thing is the healthy diet. So encourage your child to take advantage of digital tool that get them up and moving, like online exercise videos for kids and video games that require physical movement. So remember to balance online recreation with offline activities, including time outside if possible. Another important thing is healthy diet. So eating a healthy diet is very important during the COVID-19 pandemic. So what we eat and drink can affect our body's ability to prevent, fight, and recover from infections. So here are some tips for maintaining a healthy diet. Eat a variety of food, including fruits and vegetables, and cut back on salt. So use limit salt intake to 5 grams per day. Eat moderate amounts of fats and oils and limit sugar intake. Avoid hazardous and harmful alcohol use. Stay hydrated, that is, drink more water. So, good hydration is crucial for optimal health. And more important thing, here are some tips also and advice that we hope you will find useful. So, we have a routine. So, have a routine. Keep up with daily routines as far as possible or make new ones. Keep informed. So minimize news feeds. Social contact is very important. Help others. Support health workers. And don't discriminate. Be kind. Get up and go to bed at similar times every day. Keep up with personal hygiene. Eat healthy meals at regular times. So healthy exercise is very good for our health and mind. Allocate time for working and time for resting, and make time for doing things you enjoy. Collectively, we must resize the moment to work together to provide essential health intervention to everyone and to build back stronger. Thank you.